A major analysis of nearly 10,000 patients just confirmed something that will change how you think about knee pain forever, and most doctors aren't telling their patients about it. Simple, non-drug treatments, things you can do at home, things that cost little to nothing, were shown to significantly reduce knee pain, improve mobility, and restore function in adults with knee osteoarthritis. And not just slightly better than medication. In many cases, these approaches outperformed medication for pain relief and functional improvement, without a single side effect. Now, knee pain is the #1 musculoskeletal complaint among adults over 60. Nearly half of all adults will develop symptomatic knee osteoarthritis in their lifetime, and by the time most people are 70, it's affecting the way they walk, the way they sleep, and the activities they've given up. Activities they've given up, and told themselves that's just aging, just part of getting older, nothing to be done. That is not true, and today I'm going to prove it to you with science and give you 7 specific non-drug strategies that the research says work that you can start implementing today. I'm Walter, and this one hits close to home for a lot of people I know. Let's get into it. Let me start by explaining what's actually happening inside a knee with osteoarthritis, because understanding the mechanism changes everything about how you approach it. Osteoarthritis is not simply wear and tear the way most people picture it, a tire gradually going bald. That's an oversimplification that leads people to believe there's nothing they can do. Osteoarthritis is a dynamic disease, meaning it's an active, ongoing biological process that involves inflammation, cartilage breakdown, changes in the underlying bone, and dysfunction in the muscles and connective tissue surrounding the joint. And here's the critical insight. Because it's a dynamic disease, it responds to dynamic interventions. The biology is not fixed. The process can be slowed, managed, and in some cases partially reversed. Your cartilage, the smooth cushioning tissue between your bones, does not have its own blood supply. It gets its nutrients from the synovial fluid that surrounds it. And that fluid is pumped in and out of the cartilage through movement and compression, which means that when you stop moving because your knee hurts, which is the instinctive response, you are actually starving your cartilage of the nutrients it desperately needs to repair and maintain itself. Rest. The conventional advice given to people with knee pain for decades can actually accelerate cartilage breakdown, the exact opposite of what most people have been told. And it gets worse. When you stop using the muscles around your knee because of pain, those muscles weaken rapidly. And the muscles around your knee, particularly your quadriceps, are the primary shock absorbers for your joint. Weak quadriceps mean more force goes directly into the joint with every step. More joint stress, more inflammation, more pain, more avoidance of movement, more muscle loss. And the cycle accelerates. This is why the conventional advice of rest, pain medication, and waiting until it's bad enough for surgery has failed so many people. It addresses the symptoms while accelerating the underlying disease. Now let me show you what the research actually recommends instead, and why it works so much better. Strategy number 1, targeted exercise. And I want to be very specific here, because not all exercise is equal for knee osteoarthritis, and the wrong kind can make things worse. The major analysis of nearly 10,000 patients specifically identified exercise as the single most effective non-drug intervention for knee osteoarthritis. More effective than braces, more effective than supplements, more effective than most medications. But the type of exercise matters enormously. The research supports 3 specific types: strengthening exercise, aerobic exercise, and mind-body exercise, and each works through a different mechanism. Strengthening exercise, specifically targeting the quadriceps, hamstrings, and hip abductors, rebuilds the muscular shock absorbers around your knee, reducing the load going into the joint with every step. A randomized controlled trial published in the Journal of the American Medical Association found that a 12-week quadriceps strengthening program reduced knee pain by 40% and improved function by 38%, comparable to or better than NSAIDs. 40% pain reduction from strengthening the muscles around the knee, not from a pill, from rebuilding the shock absorbers your joint depends on. Aerobic exercise, specifically low-impact forms like walking, cycling, and swimming, reduces systemic inflammation, maintains joint mobility, and pumps nutrients into cartilage through the movement and compression cycle we discussed. And here's something that surprises people. Walking, done consistently, has been shown to slow the progression of knee osteoarthritis in multiple long-term studies. Not worsen it, slow it. The third type, Mind-body exercise, specifically Tai Chi and yoga, has accumulated impressive evidence for knee osteoarthritis in seniors. A meta-analysis found that Tai Chi significantly reduced knee pain and improved physical function and balance in older adults with knee osteoarthritis. And balance improvement matters here, because knee pain significantly increases fall risk, and Tai Chi is one of the most evidence-backed interventions for fall prevention that exists. So exercise addresses pain, function, inflammation, cartilage nutrition, muscle strength, and fall risk simultaneously, in a way no single medication can match. Now, I know what many of you are thinking right now. Walter, my knee hurts. Exercise hurts my knee. How am I supposed to exercise when it hurts to move? This is the most important question, and the answer changes everything. The goal is not to push through pain. It's to find the movement threshold where your knee can work without being damaged. That threshold exists for almost everyone, even people with severe osteoarthritis, and finding it is the first step. Start in water if you need to. Start with seated exercises. Start with 5 minutes. But start. Strategy number 2, hydrotherapy and aquatic exercise. Water is extraordinary for knee osteoarthritis for one simple reason: buoyancy. When you're submerged to your waist in water, the buoyancy of the water reduces the load on your knee joint by approximately 50%. 50% less joint stress, which means you can move, strengthen, and exercise your knee at full range of motion with half the pain, in a way that's simply not possible on land for many people. A systematic review of aquatic exercise for knee osteoarthritis found significant improvements in pain, stiffness, and physical function, with an excellent safety profile and very high patient satisfaction rates. If you have access to a pool, whether it's a community center, a YMCA, or a hotel pool, aquatic exercise may be the single best entry point for exercise if your pain is currently preventing you from exercising on land. And you don't need to do laps. Walking in waist-deep water, gentle knee bends, and simple resistance movements in the pool are enough to generate significant therapeutic benefit. Even just standing in a warm pool and letting the water support your joint while you gently move provides measurable benefit, and that is accessible to virtually everyone, regardless of fitness level. Strategy number 3, weight management. This is the one I approach carefully, because I never want anyone to feel shamed about their body. But the biomechanics here are so important that I'd be doing you a disservice not to address them directly and honestly. Every pound of body weight generates approximately 4 pounds of force on your knee joint when you walk. So if you're carrying 15 extra pounds, your knees are absorbing 60 extra pounds of force with every single step. A study published in Arthritis and Rheumatism found that every 10 pounds of weight loss reduced knee osteoarthritis pain by approximately 50% and significantly improved function. 50% pain reduction from 10 pounds of weight loss, and that's not from medication, not from surgery, from reducing the mechanical load on a joint that was never designed to carry more than it should. And here's the additional mechanism beyond just load reduction. Adipose tissue, body fat, particularly visceral fat, is metabolically active. It produces inflammatory cytokines, pro-inflammatory signals, that directly drive the inflammation inside your knee joint. So excess body fat doesn't just mechanically overload your knee, it chemically inflames it from the inside. 2 simultaneous attacks on the same joint. Even modest weight loss, 5 to 10 pounds, produces measurable reductions in knee pain and inflammation. And the strategies from our Harahachi BU video and our processed food video apply here directly, small sustainable changes that add up over time. Strategy number 4, knee bracing. The major analysis specifically identified knee bracing as a significant non-drug intervention, and it works through a mechanism that many people don't understand. Most people think a knee brace simply holds things in place, like a mechanical support. But the more important mechanism is proprioceptive. It's about feedback. Your knee has sensors throughout the joint that tell your brain where your knee is in space and how it's loaded. In osteoarthritis, these sensors are damaged and the feedback they send is disrupted. A well-fitted knee brace restores proprioceptive feedback. It essentially gives your brain better real-time information about joint position and loading, which reduces the protective muscle spasm that causes much of the pain. There are 2 main types of knee braces relevant for osteoarthritis. An unloader brace, which mechanically shifts the load away from the most damaged compartment of the knee, and a sleeve brace, which provides proprioceptive feedback and warmth. The unloader brace has the strongest evidence for people with medial compartment osteoarthritis, the most common type, where the inner side of the knee is most affected. Talk to your doctor or a physical therapist about which type is appropriate for your specific knee, because a poorly fitted or wrong type brace can do more harm than good. Strategy number 5. Heat and cold therapy. This is the most immediately accessible strategy on this list. You can start it tonight, right now, with what you already have at home. Heat and cold work through completely different mechanisms, and knowing which to use when makes all the difference. Cold therapy, an ice pack wrapped in a cloth applied for 15 to 20 minutes, reduces acute inflammation, numbs pain signals, and decreases swelling. Use cold after activity, after a flare-up, or when your knee feels hot and swollen. Heat therapy, a warm compress, a heating pad, or a warm bath, increases blood flow, relaxes the muscles around the joint, reduces stiffness, and improves mobility. Use heat before activity, in the morning when stiffness is worst, or for chronic aching pain. A systematic review confirmed that both thermotherapy and cryotherapy significantly reduce knee osteoarthritis pain and improve function, with heat being particularly effective for stiffness and cold being particularly effective for post-activity inflammation. A simple routine that works for many people. Warm compress on the knee for 15 minutes in the morning to reduce stiffness and prepare for movement. Ice pack for 15 minutes after any activity that aggravates the knee. This costs essentially nothing. It requires nothing special, and it can meaningfully change your daily experience of knee pain starting today. Strategy number 6. Dietary changes and anti-inflammatory nutrition. We've talked about the Mediterranean diet and the Mind diet in previous videos, and everything we said there applies directly to knee osteoarthritis because the primary driver of cartilage destruction is inflammation. Omega-3 fatty acids from fatty fish, walnuts, and flaxseed have been shown to reduce the production of inflammatory cytokines in the joint. Remember our supplement video from food, not from megadose supplements. Curcumin, the active compound in turmeric, has accumulated meaningful clinical evidence for knee osteoarthritis. A meta-analysis of randomized controlled trials found that curcumin supplementation significantly reduced knee pain and improved function compared to placebo. And unlike NSAIDs, curcumin does not carry the gastric bleeding risk, kidney damage risk, or cardiovascular risk that long-term anti-inflammatory medication use does, making it a particularly attractive option for seniors. Vitamin C from citrus, bell peppers, strawberries, and broccoli is essential for collagen synthesis. And collagen is the primary structural protein of cartilage. Adequate vitamin C intake supports cartilage maintenance in a way that supplemental vitamin C alone does not fully replicate. And reducing ultra-processed foods, as we covered in our very first video, reduces the systemic inflammatory burden that is driving the inflammation in your joint. Every processed food you replace with a whole food is, in a very real sense, a dose of anti-inflammatory medicine. Strategy number 7. Physical therapy and movement education. Of all the strategies I've discussed today, this is the one most likely to produce lasting, transformative results, and the one most underutilized by seniors with knee pain. A skilled physical therapist who specializes in musculoskeletal conditions can do several things that no video, no brace, and no supplement can do. They can assess your specific movement patterns and identify the biomechanical faults that are accelerating your knee degeneration, because in most people, knee osteoarthritis is worsened by movement patterns that can be corrected. They can design an individualized exercise program precisely calibrated to your current knee condition, so you're working at the therapeutic threshold without overdoing it. They can use manual therapy techniques, hands-on joint mobilization, that have been shown in randomized trials to significantly reduce knee pain and improve range of motion. And they can teach you movement strategies for daily activities, how to sit, stand, climb stairs, and get up from the floor in ways that minimize joint stress throughout your day. Research consistently shows that patients who complete a course of physical therapy for knee osteoarthritis delay or avoid surgery at significantly higher rates than those who rely on medication alone. If your doctor has been managing your knee pain with medication for months or years without referring you to physical therapy, ask for that referral. It is one of the most evidence-backed requests you can make. Now I want to address the medications directly, because this video is not saying medication is always wrong. It's saying medication alone is not enough, and for many people it's not even the best first step. The most commonly used medications for knee osteoarthritis in seniors are NSAIDs, Non-steroidal anti-inflammatory drugs, like ibuprofen and naproxen, and acetaminophen. Long-term NSAID use in seniors carries serious, well-documented risks: gastric bleeding and ulcers, kidney damage, increased cardiovascular risk including heart attack and stroke, and elevated blood pressure. Major analysis found that long-term NSAID use was associated with a 2 to 4 times increased risk of serious gastrointestinal complications in older adults. 2 to 4 times. From a medication millions of seniors take daily as their primary knee pain management strategy. Acetaminophen, Tylenol, is safer on the stomach, but carries serious liver toxicity risk when taken regularly at higher doses, and multiple systematic reviews have found it provides only minimal benefit for knee osteoarthritis pain. Corticosteroid injections, cortisone shots, provide short-term pain relief but have been shown in long-term studies to actually accelerate cartilage breakdown with repeated use. You're trading short-term comfort for long-term joint destruction. This is not my opinion. This is the established evidence. And the established evidence says that for knee osteoarthritis, non-drug treatments should be the first line of care, not the last resort after medication has failed. The American College of Rheumatology, the Osteoarthritis Research Society International, and multiple major clinical guidelines specifically recommend exercise, weight management, and physical therapy as first-line treatments ahead of medication. The guidelines are there. The evidence is there. And yet the default in many clinical encounters is still to prescribe medication and send people home, because it's faster, and because patients haven't been told there's a better option. Now you know there's a better option. Let me also address something that comes up a lot: supplements for knee health. Specifically glucosamine and chondroitin, which are among the most widely sold supplements for joint health. The evidence on glucosamine and chondroitin is genuinely mixed. Some well-designed trials show modest benefit for a subset of patients with moderate to severe knee pain. Others show no benefit over placebo. The GATE trial, a large NIH-funded study, found that glucosamine plus chondroitin showed significant pain relief in the subgroup with moderate to severe knee pain, but not in the overall group. My honest assessment: if you've tried them for 3 months and noticed genuine improvement, there's no strong evidence they're harming you. If you've tried them and noticed nothing, you're likely getting placebo benefit at best. But please do not rely on glucosamine and chondroitin instead of exercise, because the evidence for exercise is dramatically stronger, the benefits are broader, and the mechanism is far better understood. Let's recap the 7 strategies. Number 1. Targeted exercise, strengthening the quadriceps and surrounding muscles, aerobic low-impact activity, and mind-body exercise like Tai Chi. This is the most powerful intervention available. Number 2. Hydrotherapy and aquatic exercise. 50% less joint load in water. The best entry point if land exercise is currently too painful. Number 3. Weight management. Every 10 pounds lost reduces knee pain by approximately 50%. Modest changes produce real results. Number 4. Knee bracing. Specifically unloader braces for medial compartment osteoarthritis. Talk to your doctor or physical therapist about the right type for you. Number 5. Heat and cold therapy. Heat before activity for stiffness. Cold after activity for inflammation. Costs nothing. Start tonight. Number 6. Anti-inflammatory nutrition. Omega-3s from food, curcumin, vitamin C, and reducing ultra-processed foods. Every meal is either feeding or fighting your knee inflammation. Number 7. Physical therapy and movement education. The most transformative and most underutilized option. Ask your doctor for a referral today. Knee pain is not a sentence. It is not an inevitable part of aging that you simply accept and manage with pills until your doctor decides you're ready for surgery. It is a dynamic biological process that responds to dynamic interventions, and you have 7 of them right here, backed by the best available evidence with no prescription required. Start with 1. Pick the one that feels most accessible to you right now. Heat and cold tonight, aquatic exercise this week, a physical therapy referral at your next appointment. And if someone told you that rest and medication are your only options, they were wrong. And now you have the science to know it. If this video helped you, please hit that subscribe button, because every week I break down health topics for seniors in a way that's simple, honest, and actually useful. Share this with someone you love who's been living with knee pain, because they may have given up on activities they didn't have to give up. This video might give them something back. I'm Walter, and I'll see you in the next one.